Yep. Okay. So looks like we are live there. Facebook is having a little bit of the trouble. What platform is that on that you're seeing that in?
I don't see it live.
I'm not saying anything. I'm just.
Okay. Okay, so we are live here on LinkedIn right now. Everyone, give us just a second because we are live on multiple platforms at this point. I'm getting all of that set up. So give me just a second, folks, to make sure that we are actually. We are live here on LinkedIn right now. Okay. Yeah, so and there is a mute button on that, guys, that I just saw. So I think we should be able to mute it. Bear with me, everyone. Okay, we are live on YouTube, and I am still working on this live on Facebook. It's given me a little bit of trouble. So give me just a second, guys. I'm going to have to get into the settings here. The joys of modern technology.
Yes.
And of being live.
Live is good, though.
Live is good. And at a certain point, if we can't make Facebook go, then we'll just have to go ahead and post the recording there. Okay. All right. Well, unfortunately, I am still having trouble with Facebook is not wanting to go live here. So my apologies for that for anyone who views this later on Facebook. But we're going to go ahead and get started so that the people who are here from LinkedIn and YouTube can go ahead because we know everyone is busy. So we want to make sure that y'all are getting what you came for. So hello, everyone. My name is Amelia Borland. I'm an occupational therapist and the owner and founder of Higher Standards Caregiver Training. As an occupational therapist, I have worked in the home healthcare field as a skilled provider. And through Higher Standards Caregiver Training, I am deeply, deeply privileged to be able to work with fabulous non-medical home care providers. And so I have these, because of both of those things, I have these amazing connections that I think can really help to clarify some of the differences between these two worlds. And so I want to introduce you to a couple of folks right now. So I have here with me, I have the great Lori Miller. So Lori Miller has owned a home care agency for the last 16 years. She also has her master's degree in gerontology. And full disclosure, Lori is also, along with myself, the co-founder of the Purpose Project, which is definitely something that y'all should check out. We also have here Jeff Syke. Jeff has a really unique kind of experience. He's been working in the senior care industry since 2016. And he has worked in both the skilled home health care side of things as well as non-medical home care. So having done both of those things from a business perspective, especially, he's bringing a really unique viewpoint to this conversation. So welcome, Lori and Jeff. Thank you so much for joining for this live educational event.
Before we go any further, I got a comment that someone can't hear us on LinkedIn.
Okay.
I see someone else on the chat. Pamela, can you hear us on LinkedIn? Because it was Leslie who couldn't hear us. Just want to make sure everyone can hear us.
Let's see. So it could be, do make sure, a lot of times these videos will default to mute. So do make sure that you have your volume turned all the way up, that any devices that you have are connected. I realize now that I'm giving verbal instructions when you can't hear me, so that's probably not super helpful. But then that you have your volume turned up there. I am showing that the stream health is looking really good.
Okay.
Okay, Pamela, thank you. She can hear us. So
You can hear us?
Yeah.
Okay, let me just type into Leslie.
I did.
Oh, you did? Okay, great.
Yeah,
All right, it's a little delayed on my end.
So we can just continue.
So that said, guys, I'm just going to start by putting a couple of questions out there. Lori, would you mind telling us, what is non-medical home care?
Well, thank you, Amelia. So non-medical home care can be called just home care, non-medical home care. Some even call it custodial care. That's what they used to call it. Unskilled care can be called lots of different things. But basically, the majority of what we can do is we can do companionship type stuff, like helping with transportation or visiting or oversight, general things like that, keeping people safe. We can help with meals, meal preparation, grocery stores, errands, shopping, that sort of thing, going to appointments. We can help with light housekeeping, but we can also help with personal care. So we can help with bathing, dressing, toileting, any activity of daily living. It's probably easier to tell you what we cannot do. We're not nurses, so we can't do anything that requires a license. Now, some agencies may hire a nurse, but most agencies do not. And so most of what we do would be in the companionship side or the personal care side. Some CNAs who work this. And I know from outside of Texas as well. Texas happens to license what we do. It's called Personal Assistant Services License. So we have our rules and regulations according to the state. Some states in the country do not have regulations. So that kind of depends on where you are. We don't do anything invasive. We don't make nursing calls and nursing judgment, like medical calls. We're very client driven. So we determine the schedule based on the client and based on what the family wants. We are private pay, out of pocket expense. We can talk about other ways to pay for it that exist in just a moment. And most agencies will work on a block of time. We whether it's 3 or 4 hours at a time, and you schedule it how you want. And in a quick nutshell, that's what we do.
Okay, all right, and we will dig into all of that a little bit more as we continue the conversation. Jeff, would you kind of give us an overview of the other side of the equation? What is skilled home health care?
Yes, medical home health care, which what we are in. Everything we do, some of the services, by the way, are, for example, physical therapy. We can provide occupational, speech therapy, skilled nursing. Everything we do must have doctor's orders to accompany it. So if someone needs physical therapy, speech therapy, we must have orders from their primary care physician. Also, with us, it's covered by Medicare, commercial insurance. So we can do private pay, but everything we do is through Medicare and insurance. So everything we do is medically driven.
And I think that's kind of a good way to sum it up in a nutshell. One is a medical skilled service provider, whereas the other is a non-medical, non-skilled service provider. So if you're looking for care for an actual healthcare condition, if you need nursing or rehabilitation, then home health, medical home health is really what you're looking for, versus if you are looking for daily assistance, but that's not treating or it's not treating a medical condition or trying to assist with a specific medical condition, then that is really the non-medical, private home care world. Does that sound like a good summation to both of you?
I think so.
Correct. Yes.
But of course, there are nuances to both of these kinds of side of the industry. And I think it's important to recognize, like one of the things that I talk about all the time when I'm doing caregiver training or just through Higher Standards caregiver training is the fact that even though non-medical home care providers are not providing medical care, and of course can't and shouldn't be providing medical care because it's not within the scope of those services. The fact is that often those non-medical home care providers are the first people to notice when something is wrong. And that doesn't mean diagnosing, it certainly doesn't mean treating, but noticing, because of the frequency or the duration that they're there for, noticing that something is wrong. So Lori, I'm wondering if you can talk a little bit more about, what's a non-medical home care agency to do in that situation, and how do you work? Are you connected with home health providers in order to try and connect people with what they need in those situations?
Yes. So in our agency, our caregivers actually have to write notes in their HIPAA compliant app before they clock out. So we can read the notes, and generally you will see some sort of decline, or if there's falls, or if there's issues going on where we can recognize that maybe a home health agency should be brought in. And we would call someone, and we usually do call Jeff with Higher Standards Care, and he will get the ball rolling on his end. And we do see that a lot. The important thing to know, and we get this all the time from people, if there's, let's say someone is in the hospital getting discharged for whatever reason, surgery or for whatever reason, and they say, oh, I don't need you now because I'm going to have home health come in. And they don't understand that we can work together, and we actually work very well together, because Medicare will pay for the home health. They will pay for us out of pocket, but then home health just comes in a few times a week. And so we could help either encourage them to do their exercises, their physical therapy when home health is not there, but they're still going to need some extra support even while they're having home health. And it's totally fine. It's not double dipping. It's not, Medicare doesn't care about us because they don't pay for us. So we work very well. It actually enhances some of the wonderful benefits of home health, because if the PT is coming in, say 2 or 3 times a week, we can help on the off days and encourage. A lot of people need the encouragement to continue their exercises. So that's what I would say on that.
And that really segues, I think, beautifully into the other side of it is one, you want a home care agency, a non-medical home care agency that you're working with, you want them to have a strong relationship with a skilled medical home health provider so that they can better help you to bridge that gap, right? But on the other hand, I think you highlight a really important point, which is it's so important for skilled medical home health care providers to have that relationship with non-medical home care too. Jeff, would you talk a little bit more about that?
Yes, we actually partner with Lori's company because we need each other. We really do. Like Lori said, when someone is, especially or SNF or hospital, and they get home health with us, we're only there 2 to 3 times a week, usually 45 minutes to an hour. So who is helping, you know, mom or dad or whoever with activities of daily living, fall prevention, so on and so forth. We don't want the patient coming home and having a fall and going back to the hospital. So that's why we need each other. Where we're only there 2 to 3 times a week, medically based on Medicare guidelines. Non-medical companies, the caregivers can be there 4 hours a day, 8 hours, 24/7, and they're almost really the eyes and ears, more so than us, because we're not there as much. Yet we will work with them in between when we're not there. Like Lori said, her caregivers can help the patients, clients with doing the exercises in between, keep them motivated, encourage them, because we want them to utilize that when we're not there. It's not just, okay, when we leave, okay, guys, you can't just sleep all day. You got to do your exercise. So that's where we really work together.
And I think I'd like to just kind of highlight that too, as an actual occupational therapist, in my own personal experience, how important it is to have someone continue through with the plan of care. So much of someone's therapeutic outcome is dependent on whether or not they are doing the program, and unfortunately, Medicare or commercial insurance, other payers are not going to allow your skilled providers, your therapist, your physical therapist, your occupational therapist, your speech therapist, your nurse. They're not going to allow us to be there for hours and hours at a time. And unfortunately, they're not going to allow us to be there as often as we would like to, or for as long as we would like to try to get the best outcomes most of the time. So it's absolutely imperative that there be a support system for the client or the patient at home or wherever they're receiving those services, in order to make sure that someone is trained in what they can continue to do every day and do it safely to make sure that that person has the best outcome. It makes an incredible difference. It makes all the difference. If you don't carry through the plan of care, it's highly unlikely that someone's going to have a good therapeutic outcome. If you do carry through the plan of care, you're going to have a pretty high chance of success. It's just really, just what it comes down to. So I just wanted to really beat that into the ground for a minute there.
Amelia, 100% right. I actually had both of my hips replaced years ago. And I remember distinctly when I went back to the doctor, I guess for a checkup after about 3 weeks after the surgery, they made a comment, there is no limping in this office. So meaning you got to do the rehab. You have to do the exercises and in between, because you won't heal right. And if you don't do it the right way, you're going to limp, or your goals won't be attained.
Yeah, and I'll add to that. I think something that we add to the program is we'll see the client in their home and what they can and can't do safely. So our caregivers can then tell the home health PT or OT, can we work on using her walker, or I think showering, there's some danger going on there, or just best practices that they could use in real life and keep them as safe as possible. Because sometimes our clients don't always tell the truth of what's going on when no one's around.
Or, the other thing that I have learned is healthcare and participation and independence and people's experiences are subjective, right? So it can often be tough to get a complete picture of what's really going on from only talking with one person, from only talking with the patient or the client. It's so important to me as an occupational therapist to, if they're available, talk to family members. I love talking with caregivers if I'm seeing someone clinically, because the caregivers know what's up. They can tell me so much that can help me to build a program of therapy that's way more, it's going to be way more successful, because it's going to be based, more on more about this person. It's going to be more client centered than it could be having just one set of information. So it is so, so, so important. I did want to ask you all, because I know that payment is always sort of front and center on people's minds. And, obviously skilled medical home health care has payers through Medicare and commercial insurance. But, people are always, and as you pointed out, Lori, most of non-skilled home care is private pay. But there are some other ways that people can sometimes get access. Could you talk about that a little bit?
Sure. So there is long-term care insurance policies. So that would be separate from their Medicare or their Social Security or regular insurance. It's a special long-term care insurance policy, and that will usually pay for a part or all of the services. It just depends. They would have to qualify for it, whatever that policy says, whether it's 2 activities of daily living or cognitive impairment. Every policy is different. So it just, and we can help people with that. There's some VA programs. There's the aid and attendance program, but that also has to be, it's needs and financial based. And someone can actually just Google VA aid and attendance, and it'll tell you what all the information, if you qualify for that. And that you get money depending on if you're the veteran or a widow or the spouse, and it's X amount of dollars that you can spend for non-medical home care. There's now, you could do reverse mortgage if you own your own home. That's a way to get cash to use now. There's even programs where you can sell life insurance policies. It's all regulated by the state, that you could get cash now to help you pay for home care if you want to stay in your own home. The best thing to do is save for it and plan for home care needs, which nobody seems to do. And I think when you look at the cost of it, you have to weigh, does the adult child, do they have to fly in from out of town? And that's a big expense that a caregiving agency could help with. Or, that you could put your money in one place or the other, or taking time off of work. The way home care agencies work, it doesn't have to be, all or nothing. You don't have to work 8 hours every day. So it could be, like Jeff had said earlier, maybe 4 hours, 3 or 4 times a week. And then as the needs change, maybe it increases, or maybe someone gets better and it gets less. So I think a lot of people don't realize how it works. And a lot of people don't know if their parents have long-term care insurance or not. So that's a specific question to ask, and ask if you could see the policy. And also to talk to someone to explain the policy. Because sometimes I just had a friend who called and said, oh no, his mom wouldn't qualify because the policy made it sound like she had to be incapacitated to use it. But no, it just required 2 activities of daily living, and she needs help getting dressed. So there's 1, and she needed help with bathing. So there was 2. And the way he read it, he thought for sure she would not qualify. And she also has cognitive impairment, dementia on top of that. So she definitely, and he had no idea. So that was good, kind of fortunate. But a lot of people have policies and the family doesn't know. So my first suggestion is to talk about that. And then if there's more siblings, you pool your money, and it's cheaper to have home care than to take time off or fly in or do whatever. So it's all how you look at it.
So there really are more options. Of course, like you said, a lot of this does depend on your plans that maybe were put in place when you were younger or when your parents were younger. But I think one of the big takeaways from that too is don't assume there is no way. Have a conversation about it. Call a couple of home care agencies. Talk with them. No one is going to be better at figuring out how to pay for something than owners of those businesses, right? They're going to know the ins and out of that. So call, get some, a good home care company is going to be happy to provide you whatever education that they can without being, pushy about services. And, call around, ask questions, talk to those folks, and see there might be more options available to you to tap into those services than perhaps you'd realized.
Yes,
All
I
of the
think
money.
all of this together to help seniors, period. And if someone calls us, for example, they may not need medical home health, they may need non-medical. And I will guide them and help them with resources to work with, such as Lori's company, because it sounds to me like your mom needs help with bathing, dressing, meal prep, transportation to, physical therapy or nursing. So the public needs to know to, when they're dealing with agencies, make sure they're in the right direction and not just after your services to take advantage of things you don't need.
I have a question, if I can ask for Jeff. I think it's interesting. How long can someone have skilled care like yours?
Well, skilled care, generally, when we work with patients, it's up to like a 60-day cycle, but they can recert care afterwards. It really situation, when we go in and do a medical evaluation for the patient and to achieve it, and our job is to make them heal the right way. So it could take 30 days, it could take 60. It really depends on the person. In non-medical like you, they could be on services for years. Medicare will only X amount, but people have been recerted, and then again, they heal the right way with us, and then maybe a year later we get a call that they need us again. So it really depends on the person's situation, but generally, again, if they're coming out of the hospital, they hip replacement, knee replacement, you're looking 30 to 60 days. It depends on their age, their health status.
So I want to, and so I am paying attention this whole time. I'm popping around between the different platforms that we are streaming on and just making sure that there aren't any questions that are coming in. And obviously, we are respectful of the fact that everyone is busy during the day. If you have specific questions or topics that you want us to cover, make sure that you're putting them in the chat or the comment section. Even if you have to leave, we'll answer them, and then you can watch this recording when it's available. Probably the easiest way to do that is going to be via YouTube, but there will be recordings available to posted after this is all over. So if you have a question but you've got to run, just pop it in the chat and we will go ahead and answer, as best as we possibly can here. I am showing Facebook is desperately trying to connect. It just seems to be having some trouble, but I did post on the feed on Facebook that we're having that trouble. And I asked people, if you have questions, make sure you're putting in the comments here so that they can still get those answered during the recording. Thus is the wonderful nature of technology and being live. You never know what's going to happen. I did want to ask, so I think that this is something, always, I mean, I love anything where I never quite know exactly what's going to happen. I think that's why I like doing live stuff so much. And it's definitely why I'm an occupational therapist. Because you never know what's going to happen every day. I did want to ask, because this didn't come up in the chat now, but someone had reached out to me about this, and I wanted to get some clarification for folks. Do you need doctor's orders to get home health, and do you need doctor's orders to get home care? Jeff, do you want to take that first? Oh, Jeff looks like he's frozen, so I'm going to throw that to you, Lori.
Okay, so home care, you do not need doctor's orders or anything because we're not covered by Medicare. That they don't regulate what we do. You just need to call us and that's it. You don't need a reason. You may need a reason for the long-term care insurance. That's a different story. But just to get service for us, nope, you just call, and easy as can be.
Okay, yeah, I mean, that certainly is one of the advantages of home care. Again, understanding that you're not going to get medical care or therapy through home care, but it can be a lot simpler to get access to it, because it's just a matter of making a phone call a lot of the time. Whereas for skilled home health, there are some different requirements that you probably have to meet. Jeff, I don't know if you were able to hear that. Did you hear that? Can you speak on that a little bit?
Yes.
Yes,
So with medical health services,
if you're needing therapy, occupational, skilled nursing, speech therapy.
So
to treat the patient, and generally, just I'm trying to explain this as easy as possible to anybody who's listening.
Listen,
we lost Jeff. I'm gonna take part of that answer as best as I can, just from my own sort of clinical experience. But so what Jeff was saying, if you caught it, was that yes, you do need doctor's orders to get access to skilled providers with home health therapy. Generally, anytime you're being treated for a medical condition, you're going to need orders from a doctor for that. And there are usually orders that are required for payment providers as well in order to be reimbursed. There are some other kind of general requirements that you usually have to meet as well in order to receive those services. One is it has to be something that can actually be addressed by that skilled service provider. And in general, the ability for us to actually make progress towards whatever your goals are as skilled service providers. Oh, you're back there, Jeff.
For some reason I got bounced out. And I apologize. I saw on the chat there, by the way, Robbie McCullough, who we work with together, who's also a non-medical, asked, can you zoom out a little further on Jeff? So we're working on that. Actually, Robbie, I went away for a little bit because you probably set off some electrical static. But what I was getting
fault,
back
Robbie.
to, yeah, Robbie's in trouble again. I love him. But so if someone needs our medical home health, we must have doctor's orders for them to be treated. And normally, what we need from, let's say, the primary care physician is they'll fax us which has the person's demographics, insurance information, his visit notes, or what we call a history and physical, and then Medicare guidelines. We have 24 to 40 hours to onboard a patient. It's the difference between medical health and we get somebody that needs care. Works much faster because they don't need doctors to sign off on orders.
Now, I will add that we do do an in-person assessment, and we do have to get information, of course, and get all the details. But we don't need the doctor's orders for that at all.
So I'm curious what each of you, what's maybe like one or two either common questions that y'all get when people call and ask you about your services, or it's totally up to you, or what is something that we should have talked about during this live that we haven't talked about?
Ladies
Well,
first.
You want to go first? You ladies
No,
first.
ladies
Well,
first.
there's one service I forgot to mention that we provide, which is so important for so many older adults, and it's helping with their pets. So we can help, and that's just so important for someone to keep their pet. So whether it's walking them together because maybe they're a fall risk now and they can't walk the dog, but they can walk along with the walker, and then we can walk the dog, and that's so important. Or helping with cats at home, or whatever. The probably the number one question we'll get is, does Medicare pay for that? Because a lot of times they're confused with the home health. I don't know why it's called home health care versus home care. That is just very confusing.
It is confusing.
Totally. And then another question we get a lot of times are about minimums. And somebody might just want like 1 hour. And the honest answer about that is it's just really too hard to staff, and it's never a good client experience. So that is something that can be a difficult thing to do, is just have, the same person come out for 1 hour a couple times a week. It's just, at this time, it's just too hard to staff. But most of the time it's explaining the difference, like what we're doing today, what's home health and what's home care.
There's medical home health and there's non-medical. And I think people clump together, okay, you're in the home health care world. So questions are, I just need somebody to, check on mom or dad. Is Medicare, and that's just the whole reason we're here, is for it's an educational process. We just want to help as many people as we can differentiate between, how when you bundle, it's very confusing for the average, especially when there's a crisis. A lot of times in our industry, it's a crisis.
Yeah,
we'll
that's a really good point. Yeah, Jeff, that's a really good point. Most people don't plan ahead and don't call ahead. They'll call and say, "Mom's being discharged from the hospital tomorrow," and I'll ask, "Are they getting home health?" And they'll say, "I think so." And then I'll ask. This is something I think that's really important that we should have discussed. I'll ask, "Well, who's the company?" Because I'm always wanting, higher standards. And they'll say, "Oh, I don't know. It's whoever they're sending." And I don't think people realize that they have a choice in the matter. Even though Medicare is paying for home health, if they're not happy or they're not satisfied, they don't have to stick with it, and they can get a new agency. And I think sometimes people are afraid to do that. And that's so important to know.
I think that that's a great sort of note to end off on, is that ultimately all of this information is, we want to put this out there so that people can feel empowered to make the right decisions for themselves by being educated about the process. And, advocating for yourself is always something that you not only are allowed to do, but we want you to do, whether you are talking to a medical skilled provider or a non-medical home care provider. Don't be afraid to speak up for your needs, to let people know if there are issues that need to be corrected, etc. Because at the end of the day, as Jeff said, we're all on the same team. We all want what's best for the people we are caring for, and nothing takes priority over that. So, that's really what we're all here for. So, in the interest of being respectful of y'all's time, thank you so much for joining me today. Jeff Syke with Higher Standards Home Health, the great Lori Miller with Apple Care and Companion. Thank you so much for being here. I hope that this was valuable information for folks who joined us on the live stream. Make sure that you are so after this is all done, we'll make sure and post a link to the recording. You should be able to watch it through the platform that you are currently streaming it on, but I'll also post a link with that is just a link to the YouTube recording of this to make it really easily accessible. So if you know someone who would benefit from having this information, please make sure that you are sharing that link with them so they can get access to that information, and always encouraging folks to reach out, ask questions, get educated, get the information so that we can all make better decisions for ourselves and for the people that we love.
Thanks for having me.
All right. Thanks,
Bye.
y'all.
Have a great day, everybody.
Bye. We are now, except for on Facebook.
Hi, Facebook.
And now we're off on Facebook. Oh, wait, maybe we are. And okay, there we go.